So this is Dr. Ron Valdesari reporting from the 19th International AIDS Meeting here in Washington, D.C. And it's my distinct pleasure to be joined by Dr. Grant Colfax, who is the Director of the White House Office of National AIDS Policy. Grant, welcome.
Thank you very much.
Great to have you here.
Thank you, Ron.
We wanted to give you an opportunity, Grant, to share with our viewers information about an important update report that you will be releasing. Can we hear about that?
So we're very excited because we are releasing an implementation progress report on the National HIV/AIDS strategy. And as you know, Ron, 2 years ago, the President released the first comprehensive national HIV/AIDS strategy. And the strategy has four main goals. One is to reduce HIV infections. The second is to improve health outcomes for people living with HIV. The third is to reduce HIV-related health disparities. And the fourth is to increase coordination at all levels to develop a more strategic response to the domestic HIV epidemic. So this progress report, 2 years after the release of the strategy, really describes what we've done on the federal level to make progress towards the goals of this strategy.
And as many of our viewers will know, the National HIV/AIDS strategy featured very heavily in the international meeting here, and people attended several sessions where they learned about the strategy. So we certainly want to encourage people to read the report.
Absolutely.
But Grant, if you could just maybe share some of the highlights that you think are really important from this 2-year progress report.
Right. Well, I think that there are a couple things. One is that because of the strategy, in terms of following the strategy's principles, we're making smarter investments in terms of how we're addressing the epidemic. We're concentrating resources in populations that are most affected by HIV, and we're really working to improve health systems and healthcare delivery systems. So I think there are two things that really stand out. One is that our HIV prevention resources have been realigned to be more consistent with where people are living with HIV. So we're concentrating resources where HIV is concentrated in this country. Mm-hmm. And then the second thing is really the ongoing impact of the Affordable Care Act. The Affordable Care Act has already extended coverage for HIV testing to millions of more Americans, and as we move forward, it's going to cover tens of thousands of people living with HIV. So the Affordable Care Act is an instrumental component of meeting the goals of this strategy. And then I would say that the third thing in the report that is really important to highlight is the increased coordination among federal agencies to make sure that we're meeting the goals. Until the strategy was released, we had a scattershot approach to how we approached HIV in this country. And this really brings forward that we're making progress in realizing the President's vision of a United States where HIV infections are rare, and when they do occur, every person will have access to life-extending treatment.
And I certainly know you understand and appreciate the importance of this coordination, but just again to refer back to something we've heard frequently at this meeting, that prevention and treatment must be completely integrated.
Absolutely.
And in fact, we now know that treatment for HIV is not only beneficial to the person who's infected, but can actually result in improved prevention outcomes and fewer infections and fewer transmissions.
Absolutely, and that's a key point. And at this meeting, one of the things that was really striking was the International AIDS Society released recommendations that all people go on treatment regardless of their immune status. That's following up on the Health and Human Services revisions that recommended that in March. So really, treatment is prevention.
Exactly. Great. So we definitely encourage those of you who are interested and concerned about HIV/AIDS to read the report. Certainly, if you haven't read the National HIV/AIDS strategy, that's also online, both at the White House site as well as AIDS.gov. And although a lot of what you will hear in the report is really more about what's happening with the federal partners, I think you'll find some really important, whether you're in the community, whether you're a student, whether you're in business, whether you're just a concerned citizen, I think you'll find a lot of places where you can get ideas about what you can do to achieve the vision of the National HIV/AIDS strategy. I bet you agree with me on that,
absolutely
Dr.
agree.
Colfax.
Thank you.
All
yes,
right.
very much.
Well, again, my pleasure to be talking with Dr. Grant Colfax from the White House Office of National AIDS Policy. And this is Ron Valdesari reporting from the 19th International AIDS Meeting in Washington, D.C. Thank you so much, Grant.
Thank you, Ron.